Hi everyone, this is Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today we are going to discuss instruments in obstetrics and gynecology and it is our part number 1. So आज हम क्या डिस्कस करने वाले हैं इंस्ट्रूमेंट्स किसके obstetrics and gynecology के and this is our part number 1. ओके ये अपना क्या है पहला पार्ट है. So my dear friends, before starting discussion regarding instruments for obstetrics and gynecology, I want to request all those who are new to my channel, my dear friends, please subscribe to my channel and press on notification bell icon so that you can get updates for all important upcoming videos. Okay, and another request is that my dear friends, if you really want to learn, if you really want to know about instruments in obstetrics and gynecology, then watch this video till end. Okay, so it's depend on you. Okay, if you really want to learn, then you will surely watch this video till end. Okay, so let's see. First instrument, what do you think? What is name of this instrument? What is use of this instrument? So my dear friends, this is artery forceps. इसका नाम क्या है? Artery forceps, and you can see the tip. Okay, so you can see how the tip is. Okay, and both the sides are attached to each other. Okay, there is no space in between. This is artery forceps. What is use of this instrument? So my dear friends, it is used for clamping bleeding vessel. Okay, so what is meaning of clamping? Clamping means to compress something. Okay, clamping का means क्या होता है? To compress something. So here what we are clamping? We are clamping a bleeding vessel. Okay, so it is used for compressing bleeding vessel so that it can be used for stopping the bleeding. Okay, so it stops the bleeding by clamping a bleeding vessel. Okay, and it is also used for grasping टिश्यू एट द टाइम ऑफ ऑपरेशन. ओके, सो वन यूज क्या है क्लैंपिंग, सेकंड यूज क्या है ग्रेस्पिंग. किसका? टिश्यू का एट द टाइम ऑफ ऑपरेशन. व्हाट काइंड ऑफ ऑपरेशन? ओपनिंग एंड क्लोजिंग ऑफ पेरिटोनियम. थर्ड यूज क्या है? इट इज आल्सो यूज टू होल्ड स्टे सूचर्स. ओके, टू properly stay the suture. Okay, for properly staying of any suture it is used to hold them. Okay, what is next instrument? Here you can see. What do you think? What is name of this instrument? My dear friends, this is Allis Forceps. Here is space, you can see clearly. In artery forceps there was no space, both the tips are attached to each other, but in this case you can see there is space and this instrument is Allis Forceps. Where we can use this? Okay, so my dear friends, it is used for grasping tough structure. Okay, इसका use क्या है? For grasping tough structure like rectus sheath. Okay, like rectus sheath or fascia in operation like tubectomy, abdominal hysterectomy. Okay, so this is Allis Forceps. You see it clearly now and put it in your mind, because next time if it will be asked in exam, you have to click on your mind and press correct option in your answer sheet that it is Allis Forceps and it is used for grasping tough structure like rectus sheath and also used in operation like tubectomy and abdominal hysterectomy. What is next? It is also an image of Allis Forceps for clearing the tip of Allis Forceps. Okay, so you can see here the tip, how it is appearing. Okay, what is next instrument? What do you think? What is this instrument? My dear friends, this is Babcock forceps. ये क्या है? Babcock's forceps. Okay, you can see this instrument. This is totally different from previous ones. Okay, the tip is totally different. What is use of this instrument? How you can use this? Okay, so my dear friends, it is also used for grasping. Okay, but it is used for grasping tubular structure. You can see how it is appearing from the tip. Okay, so किसके लिए यूज हो रहा है? grasping tubular structure like fallopian tube in tubectomy and in modified Pomfrey operation of ureter, appendix, etc. And the tip is atraumatic as there are no sharp tooth. ओके, सो जो प्रीवियस वाला था अपना एलिस फोरसेप था, उसमें क्या था, शार्प टूथ थी। ओके, बट हियर इज नो शार्प टूथ। ओके, यू कैन सी दिस इंस्ट्रूमेंट, द टिप इज especially I put this tip image because you can see here that there is no sharp tooth here. Okay, like Allis forceps. Okay, what is next image, or you can say what is next instrument? So my dear friends, what do you think what this instrument is? Okay, what is name of this instrument? What can be use of this instrument? My dear friends, this is band applicator for laparoscopic tubal ligation. Okay, so ये क्या है, band applicator है, and it is used for applying celastic bands to fallopian tube in laparoscopic tubal ligation. Okay, laparoscopic, so it is tip of laparoscopic. Okay, and it is a holder. Okay, it is holder on the tip. Okay, during ligation you can see here the adjuster. Okay, this adjuster is used to adjust this tip. Okay, this tip is attached to grab the, okay, this will cover the fallopian tube by this adjuster. Okay, and when the ligation is complete, here the adjuster will reopen it and we can stretch out, pull it out again. Okay, so during insertion it will be closed, and after there it will be it will get closed by adjuster, and after completing ligation it will again open, and it is a laparoscopic, for laparoscopic view. Okay, another end is used for laparoscopic view. It is also at tip. Okay, what is next? What do you think what this image is, what this instrument is? My dear friends, this is iris spatula. Iris spatula. What is use of this instrument? Okay, so my dear friends, this is used for taking pap smear for screening of carcinoma cervix. So iris spatula का use क्या है, जो main use है वो क्या है? It is used for taking pap smear. Okay, so main use इसका याद रखना भाई क्या है, for taking for screening, for taking pap smear for screening of carcinoma of cervix, and it is made of wood. Why it is made of wood? You can see here it is made up of wood. Why it is made of wood? It is made up of wood that cells can adhere to its porous surface. Okay, and the long end is inserted into cervical canal and it is rotated into 360 degree. So here you can see there are two ends. Okay, this is convex end and this is concave end. Okay, ये जो ऊपर वाला है ये क्या है, concave end है, और ये क्या है, convex end. जो concave end है वो insert होगा cervical canal में. So this is long end and this will be inserted into cervical canal and it is rotated 360 degree. Okay, and the exfoliated cells are obtained, are smeared on glass slide and fixed in Koplik's jar, and that will contain ether and alcohol in equal amount. The other broad end is used for obtaining cells from lateral vagina for knowing hormonal status. Okay, so दो ends है, जो लॉन्ग एंड है उसका यूज क्या है, सर्वाइकल कैनाल में इंसर्ट होगा, रोटेट होगा 360 डिग्री पर, ठीक है। तो दूसरा एंड है वो हार्मोनल स्टेटस चेक करने के लिए है, दैट इज ब्रॉड एंड ऑफ दिस इंस्ट्रूमेंट। ओके, सो इट इज क्लियर। लेट्स मूव टू नेक्स्ट इंस्ट्रूमेंट। What do you think what this instrument is? My dear friends, this is Cusco Speculum. ये क्या है? Cusco's Speculum. What is use of this instrument? It is a self-retaining double-bladed vaginal speculum. Okay, so double blade you can see here clearly. ठीक है. It is used in OPD for routine examination. Okay, because of limited opening, only few procedure like taking of pap smear and insertion and removal of copper T can be done. So इसके यूज क्या हैं? पैप स्मीयर का सैंपल लेने के लिए, ठीक है, और रिमूवल और इंसर्शन करने के लिए किसका? कॉपर टी का। ओके, और ये जो ओपीडी होती है रूटीन ओपीडी एग्जामिनेशन उसमें इसका यूज है। ओके, टू ब्लेड स्ट्रक्चर है, ये टू ब्लेड इंस्ट्रूमेंट है। ओके, व्हाट इज नेक्स्ट? What do you think what this instrument is? My dear friends, this is Doyen's reactor. Okay, ये क्या है? Doyen's retractor. क्या है ये? Doyen's retractor. What are the uses of this instrument? This instrument is used for retracting bladder during abdominal operation like LSCS. What is LSCS? Lower segment caesarean section. Okay, caesarean section means it is a section of uterine area. Okay, uterine जो area है ना, lower area of uterine, that is lower segment. Okay, or you can say caesarean section. And also it is used during abdominal hysterectomy and laparotomy. So इसका देख लो ये अपीयरेंस क्या है, ठीक है, ध्यान से, क्योंकि इसी के जैसा इंस्ट्रूमेंट नेक्स्ट स्लाइड में है. So what is this? Doyen's retractor. And you can see it is used for what things? Abdominal hysterectomy, laparotomy, and mainly for LSCS. What is next? Here are two retractor. Okay, this is a right angle retractor used for tubectomy. Okay, and this is a devious retractor used for retraction of deep structure. Okay, so deepness जो स्ट्रक्चर है, जो डीपन स्ट्रक्चर है, उसको रिट्रैक्ट करने के लिए क्या है? डिवियस रिट्रैक्टर. राइट एंगल किसके लिए है? ट्यूबेक्टोमी के लिए. ठीक है. What this is right angle, you can see clearly. Okay, what is next instrument? Next one is, this instrument is, my dear friends, this is Episiotomy Scissors. Okay, you can see here. Okay, this is closed one, this is open one. Okay, so you can see this is Episiotomy Scissor. Okay, ये क्या है? Episiotomy Scissors है. Let's see detail about episiotomy. Okay, so you can see here this is used for giving episiotomy, and episiotomy is given in primi. Primi means rigid perineum. Okay, before forceps or vacuum, in breech delivery or in preterm delivery. Okay, so ये कब यूज हो रहा है? ब्रीच डिलीवरी के टाइम या फिर प्री टर्म डिलीवरी. प्री टर्म डिलीवरी मीन्स टाइम से पहले जो डिलीवरी हो रही है उसमें, या फिर टाइम के ऊपर जो बिल्कुल ठीक है उस टाइम. ठीक है. सो प्री टर्म, प्री का मतलब पहले होता है ना, ठीक है. प्री टर्म एपाइस्टोमी इज यूजुअली गिवन अंडर लोकल एनेस्थीसिया. ओके, सो ये कब हो रहा है? अंडर लोकल एनेस्थीसिया. एंड व्हाट इज considered in local anesthesia? 1% xylocaine. Okay, 1% xylocaine at the time of crowning of head. Okay, when the time comes for crowning of head, means the head is coming out little bit, that time anesthesia is given. Okay, the sharp blade of instrument is inserted in vagina, protected fetus by two fingers of doctor. The cut is given mediolaterally. Midline lateral episiotomy is usually not given. Okay, so mediolaterally cut दिया जाता है. ठीक है. जो बर्थ कैनाल होती है ना, उसको वाइड किया जाता है थोड़ा कट देके, ताकि जो बर्थ है वो इजी हो सके. ठीक है. एपाइस्टोमी का मतलब यही है. ठीक है. बर्थ टाइम में जो बर्थ कैनाल है वो प्रॉपर ओपन नहीं हो पाती है, उस टाइम हम एपाइस्टोमी का यूज करते हैं. वी कट लिटिल बिट फ्रॉम बिलो. ओके, फ्रॉम mediolateral position so that birth can easily occur. Episiotomy is sutured in 3 layers. Okay, which 3 layers? First layer is vagina starting with apex, second layer is perineal muscle, and third layer is skin. Okay, so 3 लेयर के suture है, उसमें क्या है? एपास्टोमी अकर होगी. एपास्टोमी कैन extend if proper perineal support is not given. Okay, it will extend. अगर proper support ही नहीं मिल रहा है तो ये extend होगी. कहाँ तक extend होगी? anus तक. Okay, it can extend to anus and it can be seen in median episiotomy. Okay, what is next? It is Foleys Catheter. ये क्या है? Foleys Catheter है. Okay, and this is a self-retaining catheter most commonly used for drainage of urinary bladder after surgery. Okay, so you can see here a bulb-like structure. Okay, ये bulb-like structure का क्या काम है? इसको हम बोलते हैं यूरिन बल्ब. ओके, और यूरिन कलेक्टर बैग. ओके, ड्यूरिंग आफ्टर सर्जरी इट विल ड्रेन यूरिन दिस बैग. ओके, इस बैग में क्या आ जाएगा? यूरिन आ जाएगा. ठीक है. व्हाट इज यूजेस? for this instrument. This instrument is used in operation like abdominal and vaginal hysterectomy, Werner's hysterectomy, repair of vesico-vaginal fistula. Okay, it is also used for second trimester MTP, medical termination of pregnancy है MTP का मतलब okay. So it is also used for second trimester of medical termination of pregnancy for extra amniotic instillation of at cradle lactate. Okay, it is also used for diagnosis of incompetent cervix and for sonosulfonography. Okay, so it is really hard to remember the uses. You have to remember main things. Okay, you have to remember this thing, and you have to remember that what is use of this bulb, what this bulb structure will do. This will collect urine. Okay, and it is a self-retaining catheter for draining of urine bladder after surgery. Okay, what is next? What this instrument is? This instrument is green armitage forceps. ये क्या है? Green armitage forceps है. Okay, what are uses of this instrument? Let's see now. It is used as हेमोस्टेट इन सीजेरियन ऑपरेशन. ओके, सीजेरियन ऑप्शन ऑपरेशन कौन सा? लोअर सेक्शन लोअर सेगमेंट सीजेरियन सेक्शन. ओके, टू कट द यूटेराइन एजिस. ओके, uterine edges. This forceps is applied to the angle and lower and upper edges of incision. Okay, why it is applied? That incision will not increase. Okay, so हमने पीछे एक इंस्ट्रूमेंट पढ़ा था जिसे हम कट कर रहे थे. ठीक है, वो सीजर थी. तो वो जो सीजर से हम कट कर रहे थे वो इंसिजन आगे ना बढ़े, कहाँ तक? एनस तक ना जाए, उसके लिए ये यूज होगा. इसका नाम क्या है? ग्रीन आर्मिटेज फॉरसेप्स. ओके, द कॉमन इंडिकेशन फॉर LSCS means lower segment cesarean section or fetal distress in first stage CPD, cephalopelvic disproportion and abnormal presentation like transverse lie, brow, breach in primi. Okay, रफ, इसका ब्रीच इन प्राइमी का मतलब क्या था? रफ पेरिनियम. ओके, प्रीवियस टू स्कार्स ऑन यूटेरस. ओके, सो इसके यूज क्या हैं? जब LCS होगा उस टाइम हम सीजर से यूटेराइन एजेस को कट करेंगे, तो उनकी जो ब्लीडिंग होगी, एक तो उसको स्टॉप करने के लिए, एक ये जो एजेस है ना वो एक्सटेंड ना हो, उस टाइम यूज होगा ग्रीन आर्मिटेज फॉरसेप्स. ओके, what is next? So my dear friends, it is request that watch this instrument carefully and put this in your mind. You can watch this video again because these instruments are very important. Okay, it is Hegar's dilator. ये क्या है? Hegar's dilator. And now let's see what are uses of this instrument. It is used for dilation of cervix. कब use हो रहा है? Dilation of cervix in process like D and E. D and E means dilation and evacuation. D and C, dilation and curettage. Okay, and fourth gill operation and hysterectomy, cervical stenosis, primary dysmenorrhea. Okay, and it can cause perforation if too much force is used. अगर जरूरत से ज़्यादा force use होगा तो perforation होगा. And very large dilation can cause cervical incompetence. Okay, और ये जो इंस्ट्रूमेंट था इसको ध्यान से देखा होगा आपने, ये कुछ लाइक इस टाइप का था. ठीक है, और ये क्या है? लॉन्ग रोड लाइक इंस्ट्रूमेंट विद जेंटल कर्व. यू कैन सी हियर जेंटल कर्व, हल्की सी कर्व एंड टैपरिंग टिप. ओके, यू कैन सी हियर दिस टैपरिंग टिप. ओके, like this it will be taper like tip. Okay, so what is next instrument? What do you think? What is this? This is needle holder. Okay, needle को hold करने के लिए needle holder. You can see it is tip is totally at the end. Okay, why it is totally at the end? I will tell you. So this instrument is used for grasping needle at the time of suturing. Okay, so suturing करते time इस instrument से क्या है? needle को हम grasp करेंगे और suture को complete करेंगे. ठीक है, the inner surface of tip has serration and small groove for firm grasp. Okay, यहाँ पर क्या है? अंदर वाली साइड, इस वाली साइड क्या है? little bit क्या है? यहाँ पर firm grasp है. Okay, some grooves है. ठीक है, small grooves that will make grasping easily. the box jointed is placed very close at the tip to give adequate pressure. ओके सो ये जो टोटली जो टिप इसका जो नजदीक है उसका कारण क्या है? टू मेक प्रॉपर प्रेशर. ओके, व्हाट इज नेक्स्ट? So my dear friends, what is name of this instrument? What do you think? My dear friends, this is ovum holding forceps. ये क्या है? Ovum holding forceps है. And what is use of this instrument? Okay, this instrument is used for removing the product of conception. Okay, जो concepts के products हैं जो अंदर रह गए हैं उनको remove करने के लिए. And incomplete abortion. Okay, so it is case of any abortion, any conception, in that time this instrument is used to remove product of conception. जो conception का जो incomplete abortion जो हुआ है उसका जो product अंदर रह गया उसको बाहर निकालने के लिए. And in time of MTP, medical termination of pregnancy, like operations में use होगा. The tip of this instrument is rounded cup like. You can see it is rounded cup like. Okay, because it is. अब इसका यूज क्या है पहले तो ये समझ लो. इसका यूज क्या था? जो रिमूव करना है हमें जो रह गया है ड्यूरिंग इनकम्प्लीट प्रेगनेंसी या फिर बोल दो अबॉर्शन हुआ है उस केस में जो प्रोडक्ट अंदर रह गया उसको रिमूव करने के लिए क्या यूज हो रहा है? ओवम होल्डिंग फोर्सेप्स. ओके, सो व्हाट इज नेक्स्ट? My dear friends, thanks to everyone, okay, for watching this video. If you feel that this video is really helpful, then press on like button, press on share button, and share this with your friends and tell them to subscribe to my channel. And if you are new here, then do subscribe to my channel. Okay, and thanks to everyone. Finally, stay safe, stay healthy.